I like wrote a speech. Right after I got off 24-hour call 4 hours ago. And then I folded it up so I can't read it. So, my name's Happy Barnes. I'm a certified nurse midwife. I am here to extend a hand of support to my sister midwives, to the families they care for, and for all the midwives and families in Oregon that you represent. These are really historic times. Common ground is being forged. I'm here also to decry the exorbitant cost of licensing for direct entry midwives, which block safe passage for babies in Oregon. The historic part about this last year, and I'm now going to bore you with facts. The International Confederation of Midwifery adopted global standards for midwifery education, regulation, and association. And this gives us an amazing chance to adopt international standards for our practice here. Direct entry midwives, certified nurse midwives, CPMs, whatever you want to call us. We all operate for safe birth. Then in October, the Home Birth Consensus Summit met and came out with 9 common ground statements that I feel are so important that I'm going to read them. This is the list. We were consumers, midwives of every flavor, obstetricians, maternal fetal medicine experts, pediatricians, labor and delivery nurses, insurers, health policy analysts. We uphold the autonomy of all childbearing women. We believe that collaboration within an integrated maternity care system is essential for optimal mother-baby outcomes. We are committed to an equitable community care system without disparities in access for delivery of care or outcomes to all women. It is our goal that all healthcare professionals who provide maternity care in home and birth center settings have a license that's based on national certification and includes defined competencies and standards for education and practice. We believe that increased participation by consumers is essential to obtaining outstanding maternity care. Effective communication and collaboration across all disciplines is essential for optimal outcomes across all settings, home, birth center, and hospital. We are committed to improving the current medical liability system, which fails to justly serve society, families, and healthcare providers. We envision a compulsory process for the collection of patient data on key processes and outcomes, measuring these in all birth settings, home, birth center, and hospital. And finally, number 9, we recognize and affirm the value of physiologic birth for women, babies, families, and society, and the value of appropriate interventions based on the best available evidence to achieve optimal outcomes for mothers and babies. And finally, the U.S. midwifery leaders met in Newfoundland at the Canadian Midwifery Association and MANA conference and began the really hard work of making those 9 statements fact. And this is what I believe. The midwifery model of care should be the entry-level care for women in the United States. I've been doing this for 38 years. I've been standing beside, under, over women giving birth. And the World Health Organization sort of summed it up for me when I started midwifery. Their recommendation years ago, which has been reaffirmed regularly, is that the safest place for a healthy woman with a low-risk pregnancy to birth is in her home or an out-of-hospital birth center attended by a skilled midwife. And the hand that I extend in support is a hand that goes across some waters that have been troubled. I reach out to a future where there are only midwives, brave women who chart a course across the stormy, deep, and sacred water of birth. Yay, women.